Okay, terminology. All right, so you got to know your anatomy, all right, and medical terminology. That's why we have you take those classes. So body planes are really important in radiology, all right? And like all these surface landmarks that we have to use to figure out where the bones are that we're getting ready to x-ray, all right? So anatomy is just your science of the structure of the body, and the physiology part of it is how it functions, all right? And osteology is going to be the study or body of knowledge relating to the bones of the body. So we've got our body planes here, and these are basically imaginary planes that subdivide the body, all right? So we use a lot of these planes all the time when describing how we're going to x-ray something. So you've probably already heard me talking about sagittals and coronals and things like that, okay? So your sagittal plane is going to basically divide the body in half like this, okay? So right to left sides, basically. Your coronal is going to divide the body from anterior to posterior, all right? Your horizontal plane is just like cutting you in half, all right? And then your oblique plane is going to be oblique through the body somehow, okay? So here you go again, just a different view. So these are going to be really important for you to know and understand, because you're going to get several test questions on your final over this, okay? So sagittal planes, again, pass through vertically from front to back. Now, don't get confused because the wording's weird. Think about it. Passes through vertically from front to back, okay? So think about that. Don't let it confuse you on a test, all right? So, but it divides the body from right to left, all right? And this is really important too, because this is how we line up everything. So your mid-sagittal plane is specific to dividing equal halves, all right? This is a mid-sagittal plane. This is just a sagittal plane. This is a sagittal plane. This is a sagittal plane. Mid-sagittal plane, okay? Coronal planes pass through the body vertically from side to side, from one side to the other side. Good. And it divides the body from anterior to posterior, but we also have a mid-coronal plane. So again, that's dividing the body equally anterior to posterior. All right, this is really important for x-ray because it's really important when we take x-rays that we center our body parts, okay? And that's how we tell, by using the mid-sagittal plane and the mid-coronal plane when we're x-raying, okay? So there's your mid-coronal plane, mid-sagittal plane. If I go too fast for you, just tell me to slow down. So your horizontal planes is just going to pass crossways through the body or body part at right angles to the longitudinal axis. Yeah.
So if you're taking like an arm x-ray, does the coronal and sagittal apply to that as well, or what?
Yeah.
Okay.
Because, so like if I'm taking a picture of my arm, I've got a center here, okay, which it'll call it the MSP, okay, or here, okay. So your horizontal planes are going to be positioned at right angles to the sagittal and coronal planes, okay. There you go. Come across there, and this is just the right angles. All right. Divides the body into superior and inferior portions, also called transverse, axial, or cross-sectional. So for x-ray, We don't worry so much about the horizontal plane. That comes more into play when you're doing like CT and MRI, okay? Because they're doing a lot of axial and like transverse planes in there, okay? So oblique planes pass through the body part at any angle between the previous 3 planes. So we got some, couple different ones too. So we have an interiliac plane and an occlusal plane. So your interiliac plane is going to transect the body at the pelvis at the top of the iliac crest, okay? Your occlusal plane is like this plane right here, right above your like upper and lower teeth, okay? Like, so, and do I have any dental assistants in here? No, I sometimes have some. They use a lot of occlusal planes when they're. So the occlusal plane, this is what we use this one some when we are doing head work, okay? So there's your occlusal plane and interiliac plane. There again. All right, so you got body cavities too. So we've got your thoracic and abdominal body cavities. I mean, those are pretty, I mean, I kind of say it all right. Thoracic's your thoracic area, and abdominal area. Abdominal cavity has no lower partition, but the lower portion is also called the pelvic cavity. So, or you could call it abdominopelvic cavity. Okay, kind of gets the pelvis in there as well. Thoracic cavity contains pleural membranes, lungs, trachea, esophagus, pericardium, heart, and great vessels. There's your abdominal cavity and all it contains. And then your pelvic, rectum, urinary bladder, heart, and reproductive system. So we kind of break them down because that's the way we kind of x-ray them, okay? So you've got divisions of the abdomen as well. So we have quadrants and regions. So these are important because when we take an x-ray and we've done the history on the patient might tell us they have pain down here. Well, that's right lower quadrant pain, and that's important because, yeah, we might have an appendicitis going on. Okay, so it's important to be able to tell the doctor specifically, the radiologist, because they don't see the patients, not like the hospitalists or ER docs or whoever happens to be seeing the patient. The radiologist doesn't see the patient. They rely on you to tell them specifically where their pain is, okay? Because it's a big area, right? So you've got your right upper quad, left upper quad, right upper quad, left upper quad, right lower quad, left lower quad. They're there again. And there's your regions as well. And they're all just different identifiable areas that you might need to tell the radiologist, where the pain is. It's like some people can have umbilical pain or in the umbilical region, and that is also appendicitis. Okay, it doesn't have to be the right lower quad. Good. Right upper. Good. Right upper. C. Osteology. Good. So we've got surface landmarks that we use, all right? And that's because we have to palpate our patients to find them sometimes, okay? So if you thought you were going into radiology and you weren't gonna have to touch your patients, you're very, very wrong, okay? I say this because I've had students quit the program because they didn't realize they were gonna have to touch patients so much. So we do touch patients a lot, like every patient, I'm gonna touch them. So, huh?
I was just saying, how would you not know that, medical field, you're gonna touch them?
I know, well, yeah, I think people just think push button.
Oh, yeah.
We don't just push buttons, people do a lot of things.
Just
So,
push buttons.
So a lot of our anatomic structures, we can't see them, all right? Especially if our patients have any fluff, all right? We gotta poke around, try to figure out where these landmarks are, all right? So here are our landmarks. So every body part that you learn in the program, you'll learn what landmark you're gonna palpate to get the right image, okay? So some of the big ones are your iliac crest, okay, here. You can do your greater trochanter too. You can put your hand here and you can have the patient move their foot and you can feel where your greater trochanter is. And that's important because we have to have the symphysis pubis on our x-rays, all right? Because we have to get the whole bladder on there when we're doing a KUB, so we have to know where that is without palpating their pubis, okay? And we're not gonna practice that on each other either. So, nor do I really want you palpating somebody's pubic symphysis. But it is a landmark, it is palpable. I have worked with techs that do. I mean, it's not wrong, I just prefer not to. What else? You have to know where these correspond to as well. So the iliac crest is gonna correspond to L4, L5, all right? And there's a method to the madness, and that's because when we're doing like a lumbar, we have to know exactly where that lumbar is to get just it on the picture. So we don't do that thing I was telling you about where we take the great big picture and then collimate down to where we need to, okay? We're not gonna do that. We're gonna be better than that. So, your xiphoid process, and sometimes you also have to be careful when you're like feeling on patients, because what you're gonna wanna do is you're gonna like talk to yourself, be like, oh, I feel, oh, there's the jugular notch. Okay, well, try not to say that stuff out loud, that freaks patients out. I got a complaint one time because one of my students was feeling on a patient and they said it was their jugular notch. Well, the patient doesn't know what that is. They only hear jugular, and when, like patients hear jugular, sometimes it's like, oh God, you think like when somebody's dying, they cut their jugular or something, so then patient freaked out. I got a call. So, I mean, the student didn't get in trouble, but I was like, try not. So, and also there's, certain ones that it doesn't matter how fluffy somebody might be, we can still feel it, okay? Because you're gonna have a hard time feeling crests on people that are a little on the fluffy side, okay? But we can see a belly button, and that's the same kind of like area.
Sorry, I was just checking. I'm a little fluffy, so I was like, let me
No,
see.
like a real.
You're like real fluffy.
Real fluffy,
Like 300
yeah.
fluffy.
Yeah. So,
I was checking.
yeah. And then others, you're not even gonna have to feel it because you can just see it, and that's fine. So, and then, you've got your vertebral prominence here, which is one. So if you like run your hand down the back of your neck and that bone, that first bone that you feel that sticks out, that's C7. That's your vertebral prominence, okay? And that's important when we're doing like a C-spine, okay? Or a T-spine, actually, all right? So we've got body habitus, okay? That really affects where our organs are in our body as well, okay? Hypersthenic, your organs are pushed up higher, and then your asthenic, they're like long and skinny down lower, all right? And so when I'm doing an x-ray on somebody, I gotta kind of know where I'm going if I'm trying to get the stomach on there or something, okay? So you're gonna need to memorize these. So I haven't really been pointing out too many things that you need on this because you need to know it all, okay? This is not gonna be one of those where I'm like, oh, you don't need to know that one or that one. You're gonna have to know all this one. So here's all your organs that could be affected by body habitus: heart, lungs, diaphragm, stomach, colon, gallbladder. It all moves, okay, depending on how thick we are. So you've got sthenic, hyposthenic, asthenic, and hypersthenic. Okay, your sthenic is your average patient, hyper, your largest, asthenic is your thinnest, and then hypo.
So for this, do you just want us to know what's average, massive, slender, very slender?
Yeah, pretty much. And what they are, you know. So if I say something about being like the largest body habitus, so you know, what would that one be, or the thinnest body habitus, okay? That's body habitus. Okay, so here's one that you can kind of tell the difference. This one's better. So can you see how our asthenic person has a really long, skinny lungs, like really long, okay? But our hypersthenic, they're like short and squatty, okay? Right? So now I'm like, okay, well, I've got this like 6 foot tall chick that weighs 100 pounds, you know, like I probably might have to take 2 x-rays on her, all right? Because I'm gonna automatically assume that her lungs are gonna be really long, okay? But if I have, you know, a 5 foot person that's, you know, 300 pounds, I'm probably they're gonna be a little shorter and squattier, okay? We need to know this for the way we're positioning our x-ray film as well, okay?
And then we'll just assume like if they're skinnier, that's how they're built.
Yeah, and it'll trick you every once in a while, but
Some people could be skinny with like.
with some lung
Okay.
disease, you know, and then it's not gonna be long and skinny, but at least you know it's not gonna be wide
Right.
like that, you know what I mean? So it kind of just depends on how we're collimating and stuff when we're doing that, okay? So skeletal division, so we've got attachment of muscles, like mechanisms of movement, internal organs. It supports your frame of body, it stores your calcium, phosphorus, and the production of red and white blood cells. So you got 206 bones in your body, 80 in the axial, and then 126 in the appendicular. So your axial is going to support your head and trunk, and the appendicular is going to do your like muscle movement, so you know, your extremities. So there you go. So we also have classification of bones as well. So we've got long, short, flat, irregular, and sesamoid. All right. What's your largest sesamoid bone? Anybody?
Patella.
Yeah, patella. Scapula would be a flat bone. So you've got irregular. Here's a spine. Okay. Your long bones, like your humerus and your femur. Your short bones are going to be your little carpals. Your sternum would be a flat bone. Okay. I just went through those. Sometimes I get ahead of myself. Sternum, cranium is another flat bone. Irregular, we're going to be your vertebrae and your facial bones. Your little sesamoid bones, you got a little sesamoid bone there in your toe too. I think they're an irregular bone.
Yeah, I was gonna ask.
Which
A
one?
refresher for
Ribs.
that.
Irregular?
Irregular. Yeah. Oh, man. I gave it away. Elephant skeleton, except
C.
C. Doesn't exist. Oh, C, sorry.
Oh, see.
Which of the following can be palpated to locate T7? Anybody guess?
A. D. That's what I said, A.
Well, C is the most correct answer, but you can, A is not wrong. And that's because, so the inferior angle of the scapula puts you right at T7, okay? But if we're doing an AP chest x-ray, say the patient's in the bed, we use the jugular notch and we go down like 4 inches. Okay?
So, is it
So
A?
the- no,
Or
it's C.
It's still C?
C.
Okay, even though A makes sense
Yes, C is the most correct.
too. Most correct, okay, I like that.
One of those.
Yeah.
One of those deals.
That's, yeah, one of those. Where I'd be sitting there and I'd be on the registry and I'd be like, which one is it?
Well, like-
The most correct.
The most correct, which is C.
Yeah, because that puts you actually at T7.
But depending on what angle of x-ray you're needing is how it could change.
So, arthrology, defined as the study of joints or articulations between the bones. So, we've got functional and structural. Let's stop there. So it is not unlikely for you to have 300 some slots. Just gonna